Hi, everyone. Thank you and welcome.
Good afternoon, good morning, or evening, depending on where you are joining us from today. Welcome to the webinar, Holding Sacred Space, Mental Health and Young People, the fifth webinar in the series, Holding Sacred Space, Mental Health and Faith. My name is Amy Hong, and I serve as the Senior Executive Director of Education and Engagement here in Washington, D.C. For participants who are blind or low vision, or perhaps just listening, I'm a Korean American woman with long black hair wearing a dark green shirt. I will be moderating this webinar with my colleague, Reverend Camille Henderson Edwards, who serves as the Director of Economic Health and Gender Justice, and Toyomi Yoshida, who is our tech. As we begin our webinar, we want to acknowledge that where the United Methodist Building is located in Washington, D.C., is the traditional and ancestral homelands of the Anacostan people who lived for generations next to the Piscataway and Pamunkey peoples. We gratefully acknowledge and honor the Native peoples on whose ancestral homelands we gather and the diverse Native communities who make their home here today. A short overview of our time together. After the presentation, there'll be a time of Q&A. Please enter your questions in the Q&A box located at the bottom of your screen. After the Q&A, Reverend Camille Henderson Edwards will share ways you can get involved today legislatively to be an advocate for mental health. I am honored to introduce you to our speaker for today. Caren Howard currently serves as the Senior Director of Policy and Advocacy for Mental Health America and has 14 years of experience in legislative and political affairs and advocacy. She advises and carries out the policy and advocacy strategy for a national community-based consumer nonprofit organization whose mission is to put the voices of people with lived experiences of mental health conditions at the helm of decision-making, both at the policy table and in healthcare settings. She educates and persuades federal and state policymakers to act on a wide range of issues that impact individuals with mental health conditions, including healthcare, education, criminal justice, and housing, and she facilitates relationship between the state and local Mental Health America affiliates and their federal and state public officials. Thank you so much, Caren, for being with us today.
Hi, thank you so much for the warm welcome. I'm Caren Howard with Mental Health America. I'm the Senior Director of Policy and Advocacy, and it's really wonderful to share this space with you today. My pronouns are she, hers. I'm wearing a printed kind of little shawl, and I am based in Palm Beach County, Florida, but have the distinct honor of being a previous resident at the United Methodist Building in my 20s when I worked for members of Congress on Capitol Hill and really needed a place to stay, a place to stay that was affordable and able to support the work that I did in the community and for government at a pay that was well below what a lot of market value homes in the Capitol Hill region were. So in part because of the location of the United Methodist Building, I was able to be as present as possible in my work, working with members of Congress and their staff, and kind of learning about the legislative process so that I can now do the work that I get to do with you today and throughout every day. I'm really at a place where my work is my passion, and I spend a great deal of time being appreciative for the opportunity to reach folks. I'm always coming from an advocacy angle, so I guess I'll just start with some description of the current mental health status or prevalence in youth. I'll talk a little bit then more about solutions and ways that we can support young people's mental health today and going forward. And I want to start by sharing that mental health conditions, our mental health and mental illness all kind of occur on a spectrum. And that spectrum really is it changes. We go up and down the spectrum from day to day, from week to week, from year to year. And at any point in time, any of us can experience mental distress or mental health condition and mental illness. Mental illness occurs about in 1 in 5 adults at any given time, 1 in 4 children at any given time. In childhood, it's considered an emotional disturbance, a serious emotional disturbance. There is limited funding for identifying, educating, and really supporting young people at the national and state level when it comes to community-based services for mental health. And when I say community-based, I mean those that are based out of more schools or churches or community organizations that are nonprofits built up from the ground and in the community that they wish to serve. And unfortunately, a great number of people have been institutionalized with mental health conditions. For instance, though the Community-Based Mental Health Services Act was signed into law by President Kennedy in 1963, and hospitals were shut down, and psychiatric institutions that had been known for decades of abuse against individuals went out of business. There really was not that funding and investment in community-based services. So people would continue on their journey throughout this kind of process in the 60s and 70s and 80s. And we saw that as people left hospitals that were being shut down, they would end up in our criminal justice system. And for crimes like petty thief or things that would actually, be indicative of a problematic health condition that really needed a health treatment. But unfortunately, as we know, mental health has been siloed. Mental health and substance use services and treatment has been siloed from the medical care system. And so although that was in part by choice, there needed to be special attention and retreat offered to people with mental health conditions and substance use disorders. That separation ended up really being a way to further stigma, discrimination, and kind of that separate but equal in name only concept around behavioral health services. So we're at a time now where we're trying to help educate Mental Health America and the advocacy groups that we work with as part of the Mental Health Liaison Group. That includes other organizations you might have heard of, like NAMI, like the American Psychological Association, American Psychiatric Association. We're doing all of this kind of work together in tandem with them to promote an understanding about the importance of integrating mental health services and supports beyond just whether you have a diagnosis, but when someone is experiencing emotional or mental distress, that they have a compassionate and appropriate response, and that they are not funneled into our justice system. And a part of that compassionate response starts with peer support and engagement in a way that is relationship building and not in a way that is authoritative and I know best. That is also meaning that there needs to be better systems talking to each other. So if an education system, a justice system, a child welfare system, and a church all have different data, information, and knowledge about individuals and what's happening, they should all be able to talk to each other with digital literacy tool or digital electronic record tools and things to promote sharing of information to support the needs of individuals, regardless of whether the need is mentally healthy, health related, or related to another part of a person's livelihood, including their housing, their transportation, their ability to connect with other services. So as this pertains to young people, we see that even in systems that have been working, there is a great deal of oath, kind of lackadaisical attitude about putting children into adult serving systems. And so as we talk about what is best for the needs of children and how to promote youth and their development, we really need to talk about, are systems safe for them? And how are young people being involved in designing systems from upfront, from the beginning, or designing practices and being involved in the decisions that are being made about them, so that they're able to feel safe in these systems. I always say that that spectrum that I alluded to earlier, from mental health and well-being and mental illness, and however they co-occur at the same time, we always need to have like a toolkit that we can go to. And the toolkit for me starts with kind of self-awareness and the ability to express. So for me, that's journaling, that's writing poems, that's singing, that's having these hobbies that really support my joy. That is also food and nutrition. Research shows that our guts are our second brains. So our minds and our bodies, through our guts and our minds, really work very closely together to facilitate and support our overall health, including our mental health and the ability for our brains to process information and for our emotions to be regulated in a way that is conducive to a life that is fulfilling and that is helping us meet the goals that we set for ourselves. Additionally, I think about the importance of belonging and connection and the balance that that has with taking time for self and having a healthy balance between connecting with others in our community, sharing ideas, growing our shared interests, and spending time doing things together that we enjoy. Those are all really important activities for socialization, especially at a young age, and also for connection that really reflects the inner spiritual connection that we all have as we're all connected in one. And so as we're coaching, leading, and working with young people, I think it's important that we also model these healthy relationships with connecting to others and having time for self. And that includes offline, which can give you more time for sleep, which is another really important topic that contributes to mental health. Ensuring that there are set times offline with lights out, in a quiet place. And some of us have the luxury of being able to do this in our homes, and some of us actually have to think more creatively. Can it be a car? Can it be an office space? Can it be an outdoor space? Connection to nature, is an important part of that toolbox as well. And do you have time to meditate, pray, and make that really safe, sacred space for yourself, for your thoughts to process? I think that I saw somewhere young people are getting over 4,000 notifications per day through either phone or computer access. And can you imagine what impact that has on the brain and the ability to focus? MHA's largest program is an online screening program that is online at mhascreening.org. So I'm going to drop that into the chat. And the #1 top screen, which is the newest screening and shot up past all the other screenings within 3 months, is the ADHD screening, which over 30% of the people taking that screening are below 18 years old. So they're realizing that something is happening with them, but they're not sure what to do yet. They're looking for information, they're looking for resources, maybe a connection to a peer community or peer group, or support from others around their age group. And what MHA does provide are some of those informational materials. For instance, we have a page on just terms for mental health. SAMHSA is the Substance Abuse and Mental Health Administration. They recently released this huge findsupport.gov initiative, which helps people to determine what type of support they might need, because they launched treatment.gov and realized, well, a person has to know what type of treatment they want or need in order to go ahead and start looking for researching providers to see, booking the appointment, following up, and going through all the steps that are necessary to actually start treatment, whether that's medication or psychotherapy or a combination of both, or even if it's looking for just kind of some case management care and case management help. That done through a payer is going to be a process. And so we making it easy for folks to access this information and help themselves? Not quite. Support.gov was launched, and I might be able to pull it up on screen, but if not, I will drop that in the chat as a resource for figuring out what actually might be the most helpful way forward in tracking what next steps to take after taking a screening. Let me pause and just allow a minute for questions, and then I'll pick back up a little bit. But I want to just make sure if any folks are thinking of ideas or want to drop anything into the chat, I'm happy to respond to those. Okay, there are two other resources that I want to hit on before I go into a little bit more about where we are in national advocacy discussions. So when I say youth, I'm talking mostly about youth under age 18 and down to, we have, 8-year-olds reporting thoughts of suicide and self-harm. We've had 5-year-olds, not maybe, I don't know if 5-year-olds are reaching out through MHA screening, but 5-year-olds have even reported thoughts of suicide or self-harm. And so conversations with parents and mothers and birthing individuals and families and caregivers are really important to have as a part of your strategy to be approaching youth mental health. We certainly are elevating the voices of young people themselves. They have intuition, they have ideas, they have desire to be part of the solution. And so we're uplifting their ideas. We also know that the attitudes of parents, household members, and other caregivers have a great impact on young people. And so if a young person is continuously having healthy behaviors, asking for help or reaching out for help, however, the household is not supportive of that, there really needs to be some education and support for their caregivers. Now, if we're talking about young adults, since 50% of mental health conditions present signs and symptoms by age 14, but then when we go up to age 25, we know 75% of them have shown some type of signs or symptoms. We're just not picking up on them. Or if we're picking up on them, there's a lack of workforce, there's lack of accessible services, there's plenty other, kind of problems I could go into. But what we do need to do is really hold space. And a part of our sacred space that we're having for youth mental health is literally just opening the door to conversation. Having a conversation can be the difference between absolutely life or death. There is a myth that if you bring up suicide, then you will have, someone have more thoughts about suicide. But it's not the case. In fact, a person is more likely to appreciate the ability to open up and just have safe space. And it's space that is open, welcome, understanding, non-judgmental. And you probably hear my Pomeranian Chihuahua in the background here, so excuse his barks, but his name is Colin and he's here with me. I want to show some stats. So there are two amazing researchers. One of them is Janelle Cubbage, who is at the Johns Hopkins Center for Gun Violence Solutions, and the other is Leslie Adams of Johns Hopkins Bloomberg School Department of Mental Health. Both of them came together to write a more recent report on ringing the alarm and the enduring call for preventing Black youth suicide. So when it comes to suicide prevalence in the last decade, it is great news that white youth have kind of leveled off and do not continue to increase their rates of suicidality, thoughts of suicide, or self-harm, or even attempts at such. Unfortunately, the same leveling off has not happened in other racial groups. Black youth are, and LGBTQ or queer youth are the number one kind of demographic for suicide. And there, again, have been ideas that mental health only impacts certain people. And no, we know that as part of the oppression of people, as part of marginalization of people, their voices and their power really has been taken away. But we have to ensure that family members, caregivers are educated about signs for help or signs that are calls for help, and what it means to have a system of support in place for mental health and possible substance use issues. So thoughts of suicide or self-harm typically occur with another condition, but can occur without a diagnosis. So someone doesn't have to already be diagnosed with depression or bipolar or psychosis or schizophrenia, which includes psychosis, to have a episode of suicidality. However, many people who attempt suicidality go on to live great lives. And if they can get out of that moment of distress, and if we're helping young people to do that, then we can save lives, because suicide really is a preventable death, although it's the top 2 leading cause of death for children in America right now. This report builds on top of the Black Youth Suicide Commission, or emergency task force that Congresswoman Bonnie Watson Coleman of New Jersey created in 2018 or 2019. And they released a report in December and released legislation, the Pursuing Equity in Mental Health Act, which in part was passed into law last year as part of the Consolidated Appropriations Act in December. And that created some funding for research of the impact of social media on youth. And again, if you're getting 4,000 different notifications per day, how do you figure out, at 11 or 12 years old, at 14 or 15 years old, even at, 6 or 7 years old, depending on how early you're getting a phone or a tablet, how do you determine what to pay attention to, what to put your focus on? How to find that balance between that connection and what you might need in your sacred space. This is such an important topic for me and hits home because I truly have always tried to create sacred space for myself, in part due to necessity and in part due to being observant about the world around me, but in part due to how my brain works. I think I noticed that having time off, having time away, having time not processing the things happening around me has just been, but just observing the things that are happening around me has just been probably a reason that I can kind of be in the space that I am today. And I'm just truly thankful that I get to share the importance of that space with others. My space can be prayer, it can be meditation, it can be writing, it can be in nature. I encourage anyone working with young people in their mental health to kind of come up with a list. This is similar to what people who are in recovery from substance use disorders or mental health conditions would say is a WRAP plan, WRAP, which is this amazing kind of theory and workbook that a mental health advocate created to help individuals write down what's important, that to help them remember what to do during times of distress. and help them to be intentional about ensuring that a time of distress is certainly that, but that then they can move on and continue with their life after the time of distress, understanding that times are always changing. We're always having ups and downs in our lives. um, the 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 message, I guess, from the Black Youth Suicide Task Force that Congresswoman Bonnie Watson Coleman led really is that the policy space has not held space for young people, especially Black and Indigenous and Latino and Asian and other Pacific Islanders. Like, there has not been a space for these children to really feel free. In fact, the Centers for Disease and Control Prevention do an annual survey, the Youth Risk Behavior Survey, every year. It is the key way to measure youth public health in America. Unfortunately, there have been some recent political controversies around it in certain states, and Florida recently opted out of some of the questions. However, it's a very comprehensive data set. And in 2021, it was high schoolers were assessed this survey, and it were found 44% of high school youth in 2021 felt they had been hopeless or felt helpless for more than 2 weeks in the past year. 35% of the youth who took that survey felt like they had been treated poorly at school or at work because of the color of their skin or their ethnicity. It found that 1 in 10 teenage girls had been had seriously attempted or considered attempting suicide. That is up 60% from 10 years earlier. And it also found that connection and belonging were really protective factors in whether or not a youth felt like their outlook was more positive. In fact, we know that the difference between a young person who ends up being overcoming adversity and one who kind of succumbs to it is whether or not that young person has access to a caring adult in their life consistently. That person does not have to be a parent. And so, as faith leaders and community leaders identify special adults who are able to connect with young people and ensure they have safe space, that really can mean the difference between whether or not someone feels like they have the capacity to meet their goal and to overcome, or whether or not someone feels like they have no control over their life and their decisions don't matter. The other thing I wanted to share with you all, yes, please do put questions into the chat. I'm really excited about any perspectives or ideas that you all are having, any questions that are going off in your mind. I'd love to answer them. I also wanted to share an additional resource. This is called Hope, a Guide for Faith Leaders to Help Prevent Youth Suicide, and really was put together with a group of spiritually inclined folks at the Substance Abuse and Mental Health Administration. The way that this is set up really is to inform faith community leaders about how important their role is in youth and how faith community leaders being educated on mental health and suicide issues, and being able to talk about these really difficult and heavy topics with compassion, with conviction, and understanding that there is some science behind it. I think that it will go a long way in building community. There are also convenings happening with leading organizations to bring spiritual leaders together in approaching mental health work across the country. So if anyone is interested in being more involved, I think MHA's CEO is leading a task force and will come out with some recommendations soon. So I'll make sure that those get out to the group. Um, One of the things I want to, note about this report, which Brandon Johnson at SAMHSA shared with me, is that it does highlight on page 17 the new 3-digit crisis line 988. The difference between a crisis line or a hotline, which would give someone immediate attention for de-escalating de-escalating a behavioral health crisis. And then there's also warm lines, which are maybe someone's just having a hard time and they need to vent. They need someone to talk to listen, but they don't actually need an immediate response or deployment of resources to them in the community. That's called a warm line. And pretty much each state has a warm line, but we're still working to try to build a national network of warm lines. I'm not sure if you all are anywhere close to Oregon, but Oregon has a leading model called Youth Line for Warm Line. And what that offers is support. It's other youth who are volunteering their time and dedicating it to help peers who just don't feel like things are going really well for them in the moment. And then they train other peers to kind of do that work and maybe volunteer an hour or 2-hour shifts. So warm lines and hotlines are both resources for individuals who have experienced, thoughts of suicide or self-harm. Let's see here. Okay, so I will just give me 1 minute and hope that there are some questions that can be dropped into the chat. Thank you all so much, and then I'll be right back. Hi, thank you for your patience. The dog really had to go out, so I just took a moment to let him outside and back now. I see that a question did come out about the first aid training for youth, and mental health first aid training is a great way to kind of open the door to conversation. However, there are so many ways to really open the door. Mental health first aid training can be considered mental health literacy, a part of mental health literacy. Part of mental health literacy is just growing the understanding of the terms that we use, like mental health, mental illness, distress, belonging, connection, and what we mean when we say these words. And then it's also a demonstration in how our lived experience can connect so well with other people's lived experience. There is a effort across states to improve mental health literacy and education in school systems. So you might see that education departments have started to deploy mental health first aid. They have both an adult version and a youth version. And those trainings do help with kind of building some awareness around how to facilitate our own needs or the needs of another individual that we're around who may be in crisis.
Karen, so a few questions came in that I can also kind of help facilitate the Q&A session, I guess, since we've kind of entered into that time. So a question for you, COVID-19 and the pandemic was such a big cause of stress for a lot of people. How did it impact young people, and have there been and are there any resources available to kind of address the mental health struggles from the pandemic?
Yes, so COVID-19 was a very distressing time for various reasons, and the impacts that it had were increasing the feelings of helplessness or hopelessness in youth, as the CDC report noted. We also saw increased suicidality and the screenings, especially in Black youth or LGBTQ youth. And then we see additionally the impact that certain legislation has on youth as well. So young people are being exposed to a lot of harmful and traumatic information or media, and it in effect has had a result of increased anxiety and distress. Some of the things that are available, some of the resources that are available for young people, as I mentioned, are like findsupport.gov. That's one way. There's the 988 warm line or hotline for young people in crisis. There are warm lines in each state. The way that you would, there's actually a website if you want to find a warm line. So with 988, they can text. With warm lines, some of them have text capabilities, some of them you have to call, but there's a website, it's www.warmlines.org, and you can find more local help. There are a great deal of support groups and peer support groups that young people are building in their schools. One of them that's really important for parents and caregivers and faith leaders that are involved in education systems is ensuring that student organizations that are alliances between students with the help of a staff member or the agreement of a staff member to facilitate, that allows students to get together and talk about what they're experiencing and share information. such as MHA screening, where you can check in, take an assessment with yourself. No one else gets that information, just you. And after you screen for a condition, whether it's anxiety, depression, an eating disorder, a substance use disorder, once you take that screening on MHA's website, you automatically get offered more information about that condition for which you screened. And then do-it-yourself tools and worksheets and ways to approach kind of getting through potentially on your own having that condition before you would need to connect to professional services. Now, of course, if a person wants to connect to professional services, a young person needs to really either go through their school or go through their parents' insurance. If they're, a young adult, they would need to go through their insurance, whether that's Medicaid or another private insurer. There are also community mental health centers that offer supports and services at reduced rates and even for free, depending on an individual's need. And so doing a Google search and looking for a community mental health center or a community health center that's offering mental health or behavioral health services is another strategy that allows people to pay out of pocket. Now, MHA has affiliates in 42 states, and many of our affiliates actually offer services and supports or are connected to other organizations offering those services and supports. So if you are looking for a local organization, since I'm in the national office in Washington, D.C., or that's where my job is based out of, you can reach out to me or you can look on our website for our affiliate with your closest to your zip code. We have really, really strong, large affiliates in Los Angeles, in New York, in Colorado, in Tennessee, in New Jersey, in Minnesota, and Utah, and there's just really a great deal of opportunity to be connected to services through those affiliates and services that are recovery oriented, compassionate, and person-centered, which value the background of the individual and perhaps are trauma informed. They're going to take into account an individual's background as much as possible.
Thank you. Another question, and you kind of already spoke on this a little bit, but a lot of those that are listening right now are clergy or lay members in the church, and some are working directly with youth in their church. What are some ways that faith communities can work with, with the youth to facilitate space for mental health conversations and support?
Excellent question. So the protective factors for mental health conditions and suicide are connection. So I think that the best way for faith-based leadership to really support the mental health and safety of youth and grow the belonging and connection is by asking a young person what they feel they need. By asking them, you are then able to come up with ways to meet that need and then ask them, hey, when you said you need XYZ, I thought that meant we could do ABC. Are these activities things that you would contribute, that activities that you think would contribute to your health, your overall health? And if they say no, then you have to go back and kind of brainstorm with them a bit more. But I do think that getting the input of young people is really the first and most important step in creating a space for them to feel belonging. The WRAP stands for the Wellness Recovery Action Plan, and actually outlines that there's a workbook, and it outlines steps that a person just kind of like fills in for themselves to help them identify what actions to take during a time of distress. For instance, if they have experienced a traumatic incident, or they have been triggered by a word or a voice or a activity or action outside of their control, they can go to this WRAP plan and visit, okay, what did I tell myself I was going to do in this type of situation, or when I'm triggered like this, or when I have this thought. And that plan is kind of a contract an individual makes with themselves. But the space to do these WRAP plans is made in a supportive environment with a person with kind of lived experience of a mental health condition or substance use disorder. And they are typically the ones who are leading these classes. And that gives them an opportunity to share their recovery and their lived experience and their story, so that others, so they're teaching others who might not be as far along in their recovery.
Thank you. And for those that are listening, feel free to submit more questions. But one of the questions, and this might be the last one if we don't have other questions coming in, Reverend Camille Henderson Edwards will be speaking more about some legislative actions that people can take. But I was wondering if there are any from Mental Health America that you would like to highlight.
Yes, thank you so much for this question, Amy. I've been so excited to talk about this part of the program because I truly am an advocate at heart. Recently, Senator Klobuchar and Senator Britt, Klobuchar and Britt, introduced the Youth Mental Health Research Act. The Youth Mental Health Research Act would authorize $100 million at the National Institutes of Health for researching youth mental health, factors that contribute to mental illness and mental health conditions, as well as what interventions are available and should be made available and scaled up to address youth mental health concerns and improve youth mental health. There's also an effort to dismantle the CDC as a public health agency. And so reaching out to members of Congress to not only support the research bill that was introduced, but also to support a robust public health agency that can deploy and activate information to the public quickly. It is a really important goal of ours, because there really is no health or public health unless you think about how people can get access to mental health information. And the CDC is the only organization doing anything in terms of like providing best practices for youth mental health programs in schools and sharing the data and prevalence of mental health. And I'll also make sure that I leave, otherwise my youth programs director would not be happy with me. I want to promote youth peer support, and Representative Byer from Virginia and Congressman Senator Hickenlooper from Colorado have a youth peer support legislation that they will soon introduce. That would be grant programs for setting up peer counseling in schools. And peer-to-peer counseling is low cost, but very high efficacy in helping to empower young people to help themselves.
Well, thank you so much for sharing those. And thank you so much for your time with us and for your presentation. As we move into the next kind of part of our webinar series, again, we provide these educational opportunities to advocate, and I'm really thankful for Reverend Camille Henderson Edwards to be here to speak on some legislative opportunities that you can take today. Thanks, Camille.
Yeah, Caren, thank you for sharing the legislative priorities that MHA is focusing on. So I'm sure that there is some space for partnership and collaboration. I will just add really quickly, I know we are at the top of the hour. If we can highlight the slide with the QR codes. So throughout the series of Holding Sacred Space, we've been highlighting several different pieces of legislation that Church and Society is actively advocating for as well. I shared at the top of this journey that GBCS has endorsed the Better Mental Health Care Act, and we are focusing on, again, drawing that thread. So a lot of, Caren, what you were talking about creating community, I really appreciate your reflection on how faith communities might be able to facilitate that space for youth, and what that practically might look like in our youth groups and youth Bible study. And then I do believe that our work is drawing the thread from our practice to our public witness. And so these acts by way of action alerts is one way to do that. So we already talked about the Better Mental Health Care Act a couple weeks ago. Last week, we talked about the Community Mental Wellness and Resilience Act. And then I want to introduce to you, or at least share, it's been floating around for some time, but this is a bipartisan bill. So the Approving Coordination and Access to Resource Equitably for Youth Act, which is called the Care for Youth Act, is a bipartisan piece of legislation that has been sponsored by Senators Tom Carper and Bill Cassidy, and also looking at sort of the access to mental health care, to comprehensive and quality mental health care. This would seek to increase access for mental health services, specifically for those on Medicaid. We've been doing a lot of information or advocacy as well in terms of Medicaid expansion. And so this is a intersecting point for us to make sure that we are advocating for those expansive structures wherein there would be no surprise billing for youth. Caren, as you said, for youth either on their parents' insurance, on Medicaid, or the other insurance efforts that they have in seeking for care and mental health services. I also want to stress that if you all use the QR code right now, it is an easy way for you to advocate, but also for you to send to your communities and your churches for them to advocate as well, so that when we do have conversations with congressional offices, they have a well-versed understanding of where the United Methodist Church is, where our individual congregations lie in terms of what we see as a priority for mental health advocacy. So yeah, I just wanted to highlight those, and that is it.
Thanks, Camille. You'll be receiving an email with the link to this recorded webinar, along with all of the resources mentioned. Today's webinar is the 5th of 6 sessions, and I hope you will join us tomorrow as we hear from Dawn Brown, the Director of Cross-Cultural Innovation and Engagement Hub for NAMI, the National Alliance on Mental Health Illness, for mental health and tools for a faithful community. A sincere thank you again to Caren Howard for speaking with us today, and thank you for joining us today, and we hope to see you tomorrow. Thanks. Have a great day, everyone. Bye.